Welcome to Healthy 5 with Dr. Niyati. On the occasion of International Women's Day, I have come with certain episodes about what happens in the life of a woman since menarche to menopause. So, as you've seen, the first video was just an introduction. The second video was totally about menarche, and today's video is going to be about middle age, perimenopausal age. I've already done a video on postmenopausal age and on menopause, so I'm going to do one on postmenopausal age also. So I'm trying to take middle age, perimenopausal and postmenopausal in this video. Don't forget to tell me how you like this video. Do add your comments, your questions, and as you all know, Healthy 5 with Dr. Niyati are also WhatsApp groups. If you would like to be a part of this WhatsApp group, then do send me a message on my number. I've left my number in the description box. Many women complain that by the age of 40, they start putting on weight. They feel that this is a sort of a premenopausal period. Actually, according to me, a premenopausal period starts around the age of 45. At the age of around 48 or nearing 50, we could call as a perimenopausal age, very close to menopause. Then comes the menopause, and then comes the postmenopausal age. So in this period, I will not call it as exactly, I call it middle age, because many women have now are peaking in their careers also. In their office also, they are getting promotions, hence sometimes they have jobs of greater responsibility. Many women also are have to travel certain distances, or maybe they have to go to certain places which involves their jobs, and they're peaking in their careers, and so there is a general settled life. They're even earning better than they earned before, so they can hire house help, and in general also their household work also has reduced a little bit. Their daughters or sons are growing up helping in the house, husbands are also helping in the house. So in general, since their workload outside has increased, and so their jobs have become more sedentary, their home housework has reduced, they generally tend to put on weight. So this is the time, dear friends, in which you need to change your exercise programs. There are many videos on YouTube which are totally free, actually uploaded for service to humanity. You could see such videos and do those exercises at home. But remember, if you want a good menopause, then it's very important that you do exercise at this age. Do not, I always tell, it's very good to eat sprouts, but don't allow your body to sprout. So don't allow your body to sprout. A very good way of knowing this is that the blouse that you wore at your marriage, if it still fits you, that means you're fit. I always tell women this. So see, do mobility exercise, do functional exercises, do other, floor exercises. You could do yogasanas, you could do Zumba. There's so many different kinds of exercises which you could do. Also at this time, be very particular about your diet, because as we go towards perimenopause, premenopause, perimenopause, estrogen starts reducing, and then we could have less of calcium, so we could have body ache and things like that. Also check B12 and D3 occasionally, and see to it that you get all these things in your diet, or then you take supplements which give you these two things regularly. As we now, so this is the thing that you should do in middle age. As we grow premenopausal or perimenopausal, it's very important that at that time we do not put on weight. Again, that is the time women think that this is a menopause stomach. I tell women that this is not a menopause stomach. This is because you've got used to your diet, you've got used to your lifestyle. So you need to change your diet. You need to realize, if you are eating an Indian diet, you need to realize that now grains have to reduce in your body, in your food. You may not eat so many chapatis or rotis and rotlas like bajra and jowar rotis and other things, and rice. You can reduce those quantities, whereas increase the fiber and increase the protein in your food. So you need to change your food patterns, add more fruits which have a lot of fiber and juice to your body, add nuts. So change your diet a little bit, and also change your exercise pattern. Now see, when as you reach menopause, you're reaching 50 and 55. So generally your energy, which was you were more like you had a lot of energy to do a lot of different exercises at 40, 45, you generally tend to be a little tired. Also at this age, do not forget to check your cholesterol. Many a times the bad cholesterol also increases at this age, so do certain exercises to reduce that cholesterol so that you have a good menopause. Now I've done a video on menopause. I'm adding it to the description box, related videos, so you can see that video for how to have a good menopause. Now post menopause, women have certain problems in their body. The first thing is that they could have wrinkles, the wrinkles of course on the face, but that's more of a like looks, it concerns more about your looks. But as far as the body is concerned also, there are certain changes that occur in the life of a woman, that she could have something called a stress incontinence. That means her the ligaments that bind the uterus, the round ligament and the long ligament, they generally become very lax, and because of which she could have prolapse. So it's very important that you do exercises for your core. Also do exercises that you're lying on your stomach and doing the exercises. So those exercises like Bhujangasana, Shalbhasana, Dhanurasana are very helpful in pulling your core up and seeing to it that you do not suffer from prolapse. And also stress incontinence, that causes you to rush to the bathroom, rush to the toilet in the night also. So it reduces your night micturition also, and in general helps you to keep healthy. It's not like postmenopausal you should not do weights or you should not do certain asanas. It's not like that. If you have been doing weights all your life, then do not stop doing weights. Take lighter weights, do more repetitions. That will help you to have a good postmenopausal life, in which it's not just necessary that you look young. You should also feel young. You should be able to do your housework generally comfortably without feeling that you're growing old. That is very important. And for that, it's very important that you keep a daily routine. Many a times I advise women, generally women who have been working or who have been homemakers all their life, they feel that they do not have time to enjoy with their college friends and school friends, and so there are generally too many get-togethers in their lives. This makes them go away from their daily routine and could be a cause of rising hypertension and rising blood sugar also. So keep these to the minimum. Start doing things which will keep you happy in the house. There are many of your hobbies which you had left out, but those hobbies which will have just you and your hobby, which will be a very good idea in which you can keep happy in yourself, so that later on, when it's not possible for you to go out generally, you have many things to do in your house. You've already trained yourself to do these things in your house. So tell me how you like this video. If you liked it, leave your comments. I read your comments also, and it gives me ideas to make different new videos for you. If you haven't subscribed for my channel, do consider subscribing it. Do not forget to press the notification bell icon, because I'm coming up with many live videos for you. Thank you for being a part of Healthify with Dr. Niyati.